Alright, so we're trying to look at the next bone, which should be looking at its features. So features is more of like trying to look at the parts of the bone. So this is what is known as the ethmoid bone. So for the ethmoid bone, we are looking at the parts of it, known as the Cribriform Plate, the Crista galli, perpendicular plate, Ethmoidal labyrinths. Then we have the nasal concave, and you have the superior and also the middle one. So first is the structure of the ethmoid bone. It's another structure of it, and you can see the where this bone is located. Okay. So ethmoid bone, you should know that it's a delicate, it's a spongy bone, and it's located between the orbits. That's between your eyes, above the nose, between your eyes. So it forms part of the nasal cavity and the anterior cranial base. So it has a small size. Okay, so it has several important anatomical features. So the first one is Cribriform Plate. Cribriform Plate. Okay, so it's horizontal plate forming part of the anterior cranial fossa. Function: it contains tiny foramina of the passage of the olfactory nerve, and also fibers from the nasal cavity to the olfactory bulbs. So if fractures occur here, it could actually cause rhinorrhea or anosmia. They'll have the crystal galli. This is a crystal galli. Okay, have the crystal galli. So for crystal galli, it's a vertical projection, and it's rising from the cribriform plate. Attachment points for the falx cerebri, which is a dural fold separating the cerebral hemispheres. Okay, so moving, we have the perpendicular plate. So I think like this image is the best to teach about this. So perpendicular plate is there, and it's a thin vertical plate, and it descends from the cribriform plate. It forms the superior part of the nasal septum. So if it is fractured or deviated, it could actually contribute to nasal septum deformities. Okay, then we'll have the Ethmoidal labyrinths. So Ethmoidal labyrinths, you could say Ethmoidal air cells. Okay, so they are lateral masses of the ethmoid bone, and they contain the ethmoidal air cells, and they contribute to the medial orbital wall. You understand? So you can have inflammations here, and they could basically cause sinusitis. They will have the superior and also the middle nasal concave. So this is superior nasal concave, and this is basically the middle nasal concave. Okay, so that's what we got there. They are thin, they are screw-like projections of the ethmoid labyrinth into the nasal cavity. So function is basically to increase the surface area of the nasal cavity, and this aids into humidification and infiltration of the inspired air. If you breathe in air, for it to mix up with liquid, okay, happens at this place. So that's it for the features, or you could say the parts of the ethmoid bone.